if you're one of those people whose day doesn't really begin unless you've had your cup of coffee, this video is for you. Others are free to scroll, but if you take coffee on a regular basis and you're also taking certain medication, I think it is very important for you to also stick around and hear this out. What if I told you that that daily ritual could secretly be interfering with your health? Yes, hear me out. Caffeine is the active ingredient in coffee. So it is responsible for that central nervous system stimulant effect. You know, that feeling of alertness and that addictive tendency it has where you feel like you're not fully awake or you need to take your cup of coffee in the morning before you're active. Yes, please take notes. That ingredient is also responsible for so many drug interactions, and this can result in nervousness, insomnia, increased blood pressure, and increased heart rate. And by the way, this doesn't only involve coffee, it also involves tea, energy drinks, and sodas with caffeine packed in them. Please, you need to take note of all this. Now, the first medication you would want to avoid while taking coffee are asthma medications. I mean, your regular inhalers are fine. There's no issue there. But there's an exception, and that is theophylline. Please, if you are taking theophylline for your asthma treatment, I would advise that you discontinue coffee completely. And this is because caffeine and theophylline are more like chemical cousins. They are in the same chemical family performing functions. So if you take them together, you're simply doubling your dose. And this can result in extreme jitters, nausea, rapid heartbeats, and in severe cases, seizures. You do not want to experience that, so I would advise that you be very careful with this. So if you're taking theophylline, I would advise that you have a serious chat with your doctor. I mean, most likely you're going to be advised to discontinue coffee completely. It's for your own good. And the second medication you'd want to avoid while taking coffee are medications for your heart, like beta blockers, example, metoprolol, atenolol. And this is because beta blockers are designed to slow your heart rate and lower your blood pressure. But caffeine, on the other hand, is a stimulant, right? So it wants to speed up your heart. Caffeine can interact with your heart medication, therefore potentially reducing its effectiveness of lowering your blood pressure or slowing down your heart rate. And this can result in temporary spike in blood pressure. Please be very careful with this. Also, you would want to avoid coffee if you have GERD. This is because coffee relaxes the lower part of your esophageal sphincter, and this can cause stomach acids to move up, causing heartburn, throat irritation, etc. And this will worsen your GERD symptoms. Other medications you'd want to avoid while taking coffee are stimulant drugs. Example, pseudoephedrine, that is in Sudafed. It is a decongestant that is used for the treatment of blocked nose, like if you're having catarrh. But people also take this medication for heart conditions. So do not take it with coffee because they are both stimulants and would result in an overload of the medication in your system because it's like you're doubling the dose. Other drug examples are amphetamines, that's Adderall, phenylphenidates like Ritalin, and methamphetamines, etc. Simply avoid stimulant medications while you're taking coffee because it's going to increase the effect in your system, thereby causing severe side effects like tachycardia, that is rapid heart rate, cardiac arrhythmias, or irregular heartbeats. It can also cause a spike in blood pressure, palpitations, and also panic. So if you have a heart condition, you need to be very careful with this because this can be very, very dangerous. Next up are biphosphonates. These medications are used to treat osteoporosis, and they are usually poorly absorbed. So they need to be taken only with a glass of water on an empty stomach. So if you combine with coffee or caffeine-containing drinks or food, it will form complexes that would interfere with the drug's absorption in the GI tract, and this would result in limited quantity of drugs getting into your system. So it is best to take your pills with a full glass of water. That is the best way. Your caffeine intake should be part of your medical history, so always ensure to inform your doctor if you consume lots of coffee daily, especially if he's about to place you on certain medication, and if one of those medication is what I just said today. Also, do not consume lots of caffeine when you're about to check your blood pressure or when you're about to take your heart medication, because as I said earlier, it can cause the results to be very, very high whilst your medication is still struggling to work because, of course, caffeine is fighting with your medication at that moment. If you learned something from this video, do well to like and share and turn on that notification bell so you would be the first to be notified when I drop the next video. And until then, lead a healthy life.